stage alongside a doctor and two former drug addicts for a panel discussion, President Obama had plenty to say about the epidemic of opioid and drug abuse, including his role as a father to a pair of teenagers.
Their ability to access legal or illegal substances is very high.
And the president says this requires an all-hands-on-deck approach. The U.S. Surgeon General agrees, joining him at the National Prescription Drug Abuse Summit.
Opioids are devastating our communities, and they are costing us lives. And we cannot afford that any longer.
The only way that we reduce demand is if we're providing treatment and thinking about this as a public health problem and not just a criminal problem.
It's not bad people doing bad things. My older son Brian struggled with drug addiction for many years.
And after being clean for a full year, 25-year-old Brian took his own life in 2011 out of shame from how others saw him as an addict. His father, Gary Mendel, still struggles with it.
Some of the best times just aren't as good anymore. You know, when family gets together with that empty chair and Brian's not here, it's really difficult. It feels really good to know that we're helping others, but it still doesn't take away the hole in my heart for Brian.
He left his successful business and started Shatterproof, hoping to spare other families from being shattered and aiming to be a national organization to fill the void for this disease, like the American Cancer Society, but for addiction.
And if it takes us cracking the whip to get everybody to sit down at the table together.
A national leader with the Drug Enforcement Administration tells us they need help from pastors and other community leaders to take their streets back. The DEA's job? Start that process by taking out the biggest, baddest drug dealers and bring in some calm first.
We can't just stop with enforcement. We have to rip out the drug trafficking groups and then say, folks, there needs to be treatment, there needs to be education for kids.
And it turns out it's cheaper to get heroin on the street than it is to try to figure out how to refill that prescription. You got a problem. You know, we are working very aggressively with the Mexican government to prevent an influx of more and more heroin.
And we're working with our state and local police in Georgia, in Alabama, and other states around the country. We're having an impact.
The DEA closed out April with National Drug Take-Back Day, where the Muskogee County Sheriff's Office collected 100 pounds of unused prescription pills in just one day, adding to the 3,000 pounds they've collected in the last 12 months.
We're very focused on reducing the number of people who die from an overdose related to opiates. I don't think this is as difficult as everybody says.
Mendel's solutions are similar to the Attorney General's. Change public perception of addiction, collect more data on drug-related deaths. Then he believes the president or Congress need to act tomorrow on passing new laws, one to offer more medication-assisted treatment.
But I do believe that federal government is moving way too slow. Why isn't there federal mandate or legislative action that says every doctor in this country, you must check a patient's history before you prescribe?
Shatterproof has helped pass legislation on that in 10 states so far. And their next target is Alabama, where doctors prescribe triple the number of painkillers as some other states. But after those pills do their damage, President Obama says the federal government needs to invest more to help addicts, not just lock them in jail.
And we have proposed in our budget an additional $1 billion for drug treatment programs in counties all across the country.
This is a nonpartisan issue that demands all of us to work together for an immediate solution.
Hoping for quicker solutions, Dr. Vivek Murthy is releasing a first ever kind of report from the U.S. Surgeon General's office.
And our 2016 report on substance use, addiction, and health will bring together the best available science on prevention, treatment, and recovery.
And even though he admits doctors are in a tough spot, the Attorney General plans to launch a 50-state call to action to health professionals to improve prescribing practices, with 250 million scripts written for opioids every year.
That's enough for every adult in America to have a bottle of pills and then some.
The doctors in the VA are out of control. They are prescribing too many opioids at too high of quantities, and this needs to be stopped.
We're setting out to change behavior, and we're going to use this indicator.
The Centers for Disease Control and Prevention is taking a new hard line, urging doctors to avoid prescribing powerful opiate painkillers for patients with chronic pain.
We got 60 medical schools who've signed up and who are announcing today that they are going to make pain relief a major part of their curriculums.
The president and another father also agree Narcan needs to be in the hands of more EMTs to save the lives of those overdosing.
Naloxone should be everywhere tomorrow, not in 6 months, not in 9 months.
For complete coverage of this prescription drug and heroin problem and solutions, go to the Ending the Epidemic section of our website, WTVM.com, and all these special reports will also air next week on News Leader 9 at 11.